So it definitely lasts a year. There's no doubt about it. Having said that, this is very seductive stuff. It's almost like people who get Botox coming every 3 months. There are people that I've treated 4 or 6 times who 6 months into it say, you know what, I just want more. And since it's harmless and it makes people really happy, and I might add, yes, the men are happy because they're doing it, but so are the others in their lives. And so some people do come in at 6 months, but I tell everybody to expect to come back once a year.
Okay, great. There's some questions about cool sculpting in conjunction with Z-Wave. Do you use cool sculpting in your practice or Z-Wave after cool sculpting?
Yeah, I mentioned cryolipolysis because that's a generic term, but that is cool sculpting. So cool sculpting is the freezing of fat to lessen fat in the area, and it can take months and months and months for that to go away. And we speed that up by immediately after cool sculpting, treating them with Z-Wave therapy.
Okay. And that improves the results significantly? Or is it noticeably improved?
It's 2 parts. One is it makes the results come sooner, and 2,
Right.
it actually improves the results, yes.
Okay. Are there other technologies that you think Z-Wave would make more efficacious?
Well, so any device used for non-invasive body contouring. And so that's going to include all of the different radio frequency devices. I mean, there's so many out there, Inmo, Luminous, Cutera's devices. BTL has the M-Sculpt Neo that remove some fat as well as to tighten the muscle. We use it as an adjunct to that. As I said, we use it post-Kybella injections. We use it after Quo cellulite injections. So anything that is used for body contouring of the abdomen, the thighs, or those areas, this is a great adjunct.
Okay, there are actually several questions coming in regarding the settings for the device for ED treatments as well as cellulite treatments. So could you go a little bit over device settings and maybe treatment durations and how they may differ for ED or a cellulite treatment?
So the more energy, the better. That makes sense, right? Having said that, penis is a pretty sensitive area. So somewhere in a range of 100 millijoules to 120 is what we typically do. For cellulite, we can sometimes do more than that. But some of the guys, especially the younger guys, they want more. And so we go a little bit higher. But figure around 100-ish for ED and a little bit higher for cellulite or post-body contouring because those areas are not sensitive.
Okay, and just to review, I know you mentioned this in brief in your presentation about the amount, how many sessions in a series for ED, and also there's another question about versus cellulite. How many sessions are there in a treatment series for ED and then for cellulite?
So ED is somewhere between 4 and 8, and I typically do 4 to 6. You can do them twice a week. In my world, that never works practically. So we do it once a week. So I tell people expect to come in roughly once a week. It's not an exact science. Once a week for about 6 weeks. In terms of cellulite, treating primary cellulite is different than treating post non-invasive body contouring procedures. So if I'm going to do cool sculpting, as someone asked about, then typically I'll do this once and maybe a second time in a month. But if I'm going to use Z-Wave as a primary treatment for cellulite, I treat them much like I do erectile dysfunction. They'll come in once a week for 4 or 6 weeks.
Okay, here's an interesting follow-up question to the settings question. Do the settings change as the treatment series goes along?
As I said, more energy, the better. And so it really depends on the patient. Now, this is a probably totally inappropriate comment I'm going to make. But men, and I'm including that group, are total wusses. And so women who have cellulite treated, they really tolerate high energies. Men who have erectile dysfunction treated don't necessarily do that. And so I do try to go higher each time. I always get away with that in women. I don't always get away with that in men.
Okay. Do you feel it's because it's a more sensitive area of the body, or the difference between men and women in general?
Well, it is a more sensitive area of the body, but I could make the argument that men who get Botox injections also are not as easy to treat as women are. So we'll leave it there with that white chromosome.
Okay. So there are a couple of applicators that come with the Z-Wave device. Now, here's a question. Can the 39 millimeter applicator be used on the penis? Must I use the 15 millimeter? This must be an existing Z-Wave user.
Yeah. Well, certainly you can use the larger applicator. Having said that, it's a big applicator for a small area. And so I like the smaller applicator because it actually does hurt less. And you know, you're applying the energy where you want it. So yes, you can use the larger applicator, but ideally use the small.
Okay. What do you charge for the series of ED treatments? Can you talk about that?
Yeah. So we typically charge, and I know this sounds like a strange comment, but it's partly based by size of the area because men come in all sizes. And so the range is between $1,000 and $1,500 per treatment.
Okay. Do you also provide the P shot in your office?
I have. It's not my primary treatment. I know it's very popular. I believe that Z-Wave is the real deal with a huge amount of science behind it. I think the P shot probably does something, but I look at it as being icing on the cake.
Okay. So have you ever used P shot in conjunction with Z-Wave in a treatment?
I have. I haven't done much of that post-pandemic, but we were doing some of that pre-pandemic because it was all over social media, so we were doing some of that.
Okay, so in your presentation, you mentioned some of the risk factors contributing to erectile dysfunction. Are there certain conditions that eliminate patients from treatment, from being able to be treated?
Certainly, and I alluded to some of them. So, you know, if there are relationship issues, and that's why they can't have an erection, they're not going to respond to this. If they have neurological reasons, you know, post-stroke, where they can't have an erection, they will not respond. But the overwhelming majority of men, you know, are in that group where the vessels, you know, without even diabetes or high blood pressure, they just get smaller with age. And so 85% of people are responding. Obviously, I know if they've had a stroke, but I make it very clear, you know, if you're coming in because of relationship issues, you might want to seek therapy first and then come to me afterwards.
Right. Okay. So here is an interesting question again. If there's no response from the treatment, up to how many treatments may be done to try to
that's a hard one to answer. I've never seen that happen if you choose the right people.
Oh, wow.
Yeah, and so I you know, again, I have people on, you know, oral agents. People who are not on oral agents. I've treated some elderly men. You know, like everything else, the younger they are, the better they respond, the quicker they respond. But oh my, I have some 70-something-year-old men in the practice who, you know, really get a smile on their face.
Okay, so here's a little bit of a follow-up to the question about the fees, the charge. Do you usually charge per session, or are you charging per series, like in a pack for the whole series as a package?
Yeah, that's a great question. So again, the fees somewhere between $1,000 and $1,500. We actually charge it up front because this is one modality's treatment where if they don't do a whole treatment series, they're not going to get the ideal result. And what I don't want to have happen is people treat once or twice, go out there and not be happy, and then frankly tell their friends. So we charge them up front, and therefore they come in, they do it.
Okay, and another question about the charge, but related to Z-Wave when added to cool sculpting. Do you charge extra for the added enhanced result that Z-Wave will produce with cool sculpting?
I've done both. There have been some patients who, up front in the consult, I'll tell them we're going to do both, and therefore I'm going to charge them for it. And then there have been patients who, when we didn't talk about Z-Wave ahead of time, and clearly they were not happy in about a month, and then we treated them for free. So I think that's a little bit a subjective decision, and I've gone both ways on that.
Okay, a couple of really interesting questions here about special cases. For example, what is the success rate with Peyronie's disease patients?
Can't tell you because I haven't done it. That's really for your urologist. So okay. I actually try not to treat Peyronie's disease as an aesthetic dermatologist.
Fair enough. Okay, and then here's more of a comment. It's not a question, but you may choose to comment on it. Diabetics are more challenged to treat, mainly poor response. Would you agree with that?
So I actually don't agree with that. I mean, that's a classic group that we're treating that's in the 50 to 60-year-old range. They have decreased blood vessels. I'm not talking about end-stage diabetics. I'm talking about the typical American, who's got, glucose intolerance, metabolic syndrome. They're on some agents for diabetes. Their vessels are smaller. They absolutely do respond, and they represent a good percentage of people I treat.
Okay. We do have quite a few more questions here. I hope you have a few more minutes to spend with us.
Yours.
Okay, fantastic. Thank you. Back to the cool sculpting topic, do you feel that the massage is important following cool sculpting if you're using Z-Wave?
I do think it's important for a whole variety of reasons. One is I do think it does lead to a better, more uniform result. But two, and I'm sure the questioner knows this, right after cool sculpting, I mean, people's fat is almost like an ice cube. It's a very bizarre shape and feel. And when you do cool sculpting afterwards, it tends to soften that some. And so people feel better about the treatment to begin with. So immediately there's some improvement, and then there's better long-term results.
Okay, so it sounds like you have a lot of different applications for the Z-Wave device in your office, post-cryolipolysis, for cellulite, for erectile dysfunction, et cetera, et cetera. So the question is, how frequently are you using Z-Wave in your practice?
Well, so nobody asked about post-tattoo treatment, which we do a lot of laser tattoo removal. And
right.
Talk about frustrating. I mean, people, for the most part, are not frustrated after body contouring procedures. Z-Wave simply makes them get a better result. But there's a lot of frustration post-tattoo removal because it goes on forever. So we do that a fair amount. So Z-Wave really we use it as a primary device in cellulite, certainly a primary device in erectile dysfunction, but as an adjunctive treatment to all of those non-invasive body contouring procedures I talked about, as well as post-laser tattoo removal.
Okay. Would you care to elaborate on the post-laser tattoo removal in case people aren't familiar with that application, exactly what it's doing and when and how you apply the Z-Wave?
Yeah. So for those of you who know anything about laser tattoo removal, there are a whole variety of lasers used for tattoo removal. They're put into what are called pico or nanosecond domain pulse delivery systems, which means they deliver essentially a bolt of energy, either a billionth or a trillionth of a second. They blow up tattoo pigment, which is why tattoo removal lasers hurt. So they blow up that tattoo pigment, and then ultimately that pigment is removed by the lymphatic system. And so it becomes less and less obvious with time. Well, think about it. You treat them, and immediately afterwards, you treat them with Z-Wave treatment, and it hastens the lymphatic drainage, which we know from cellulite. And therefore, the results are better and they're quicker, and less sessions are often required.
Okay, and there are studies on that particular application with Z-Wave. If people are interested in further information, contact Zimmer Medicine Systems, and I'm sure that can be provided. Okay, Dr. Goldberg, back to some more questions. Do you use numbing cream before treatment? And I presume they're speaking about ED.
Yeah, I'm sure that's what they're asking about. Never. Yeah, I've never used numbing cream.
Oh, okay. It's just not needed?
Yeah, I don't need it. I mean, you could. I guess you could if someone wants it. It's not going to stop the benefits of the treatment, but I have never used it.
How do Z-Wave treatments alone or Z-Wave in combination with other treatments compare with other technologies that you've used for cellulite?
So if you look at Quo injections, which help the dimples of cellulite, I mean, that's the primary mechanism by which that works. And so I don't look at Z-Wave as replacing Quo. What Z-Wave does is, for those of you who have injected Quo into the dimples of cellulite, it creates a huge amount of black and blue, a huge amount of ecchymosis. And patients hate that. And so if you do Z-Wave afterwards, it goes away much quicker. So I use Z-Wave in that group as an adjunct. Having said that, we have estheticians who have used Z-Wave therapy as a primary treatment for cellulite, but that's more for the rippling, not so much for the dimples.
Okay, a couple more. There are a lot of similar questions coming in here. I'm trying to filter them for you. One doctor would like to know, do you use a moisturizer before the treatment for ED?
Well, you saw in that video that we used the lubricant there. It's really, frankly, more for me than for the patient. It just makes that that handpiece glide better. But I've done it without any lubricants at all. So, you know, that doesn't have any impact on treatment success. It just glides better. For those of you who've used IPLs, you know, for whatever you use them for, you know, sometimes you use some sort of lubricant. It doesn't make the thing work better. It just makes it glide better.
Right. Okay. You're stuck with us for a couple more minutes because these questions are still coming in, Dr. Goldberg. I'll shoot you a few more questions and then we'll end the webinar. So this may be a little bit of a mathematical proposition, or maybe you know off the top of your head. How many total shocks would you do within 20 to 30 minutes?
I generally deliver about 1,500, somewhere in that range. I've gone up to 3,000, but that's my range. 1,500, 2,000 is typical.
Okay, here's a question about plantar fasciitis. Have you ever used Z-Wave for that condition? And if so, what are your settings?
Oh, I love that. Plantar fasciitis. It's enough that I even know what that is because I've had it, but no, I've never used it for that. That is an orthopedic or a podiatric use, not a dermatologist.
Yeah, there is some success in treating that condition.
Well, no doubt about it, because yeah, it's breaking up that. I'm not surprised in the least. Yeah.